Hello, I hope you're having a great week. Today we're going to talk about postpartum depression, anxiety, and post-traumatic stress disorder. I'd like to start by saying that if something I say today resonates with you, please consider reaching out to one or all of the following resources. You do not need to face postpartum depression, anxiety, or stress alone. There are plenty of fantastic resources available. We're going to spend a few minutes defining baby blues, postpartum depression, and postpartum anxiety. So, the wait is finally over. It has been a journey. Conceiving a baby, pregnancy, many medical appointments, nursery planning, and anticipation. Your baby has finally arrived. He or she is perfect and adorable. Yet, over the first few weeks, your initial joy is replaced by all-consuming worries. Is she feeding enough? Why is she crying so often? Is something medically wrong with him? These worries are constant during the day and keep you up at night. You feel tense and irritable. Your heart might be racing. You feel panicky. Your family members start to express their concern, not just about the baby, but about you too. You wonder whether your anxiety is normal. Pregnancy, childbirth, and parenting is a difficult and exhausting process. A female goes through a lot of hormonal, physical, emotional, and psychological changes throughout pregnancy. Tremendous changes occur in the mother's world as well. After childbirth, a mother can experience a variety of emotions ranging from joy and pleasure to sadness and crying bouts. These initial feelings of sadness and tearfulness are called baby blues, and they tend to decrease over the first few weeks after delivery. Some common symptoms of baby blues, which again last only a few days to a week or two after you have a baby, include mood swings, anxiety, sadness or crying, irritability, feeling overwhelmed. I remember this one for sure. Reduced concentration, appetite problems, trouble sleeping. While women experiencing baby blues tend to recover fairly quickly, postpartum depression tends to be longer and severely affects a woman's ability to return to normal function. Postpartum depression may be mistaken for baby blues at first, but the symptoms are often more intense and last much longer. Postpartum depression involves feeling constantly sad or low, and this lasts for much more than the 2 weeks of baby blues. You might also find it hard to concentrate, lose interest in things you usually enjoy, or have feelings of guilt, hopelessness, self-blame, and no confidence in yourself. Postpartum depression affects the mother and her relationship with the baby. The mother's brain response and behavior are compromised in postpartum depression. Symptoms of postpartum depression usually develop within the first few weeks after giving birth. However, they could develop earlier throughout the pregnancy, and they often last up to, or in some cases past, a year after birth. Similar to postpartum depression, postpartum anxiety may spike due to hormonal changes in that postpartum period. May also increase as a response to real stressors, whether it's the health of the baby, finances, or in response to navigating new roles within your relationship. A history of pregnancy loss, miscarriage, or stillbirth also increases your risk for developing postpartum anxiety. If you have a history of anxiety before or during pregnancy, postpartum anxiety symptoms may also return after delivery. Anxiety and sadness may also appear after weaning from breastfeeding, and this is usually due to hormonal changes. Postpartum anxiety is common and treatable. If you have anxiety, you are more likely to have persistent and excessive worries and physical symptoms, such as the inability to relax or panic attacks. Okay, let's focus on postpartum depression for a couple of minutes. Around 1 in 7 women can develop postpartum depression. It is not a character flaw or a weakness. Sometimes it's simply a complication of giving birth. If you have postpartum depression, prompt treatment can help you manage your symptoms and to help you better bond with your baby. Alarmingly, as many as half of postpartum depression in new mothers goes undiagnosed. And this is usually because of conflicts in privacy and shame, mothers not wanting to disclose to close family members. Sadly, there's a stigma around new mothers in that disclosure may lead to abandonment or a fear of lack of support. Interestingly, studies show that new fathers can also experience postpartum depression. They may feel sad, tired, overwhelmed, anxious, or have changes in their usual eating and sleeping patterns. These are the same symptoms that many mothers with postpartum depression experience. Fathers who are young, have a history of depression, experience relationship problems, or are struggling financially are most at risk of postpartum depression. I've listed some of the most common symptoms of postpartum depression. I'm not going to read through them all, but I'll highlight just a few. Feeling sad, worthless, hopeless, and guilty. Changes in appetite where you're not eating. Difficulty thinking or focusing. Suicidal thoughts. Feel free to pause the recording and reflect on this list of symptoms before continuing to the next slide. One of the most important things to remember is that you are the best judge of whether your feelings are normal for you. Trust yourself and be honest with yourself. Postpartum depression is not entirely preventable, but it does help to know warning signs of the condition and what factors might increase your risk. Here are some tips that can help prevent postpartum depression. You need to be realistic about your expectations for yourself and your baby. Maybe limiting visitors when you first go home. Allow yourself to settle back in before you get overwhelmed with company. Ask for help. Let others know how they can be helpful to you. Sleep or at least rest when your baby sleeps. Exercise, taking a walk or getting out of the house for a break. This is extremely important. Keeping in touch with your family and friends. Do not isolate yourself. You want to foster, build, maintain your relationship with your partner. You need to make time for and prioritize each other. And expect some good days and some bad days. Yes, postpartum depression can affect your baby. This really highlights the importance of getting treatment for both you and your baby. This list of effects on the baby are very common if postpartum depression is left untreated in the mother. Children of mothers who have untreated depression can develop behavioral and emotional problems. We sometimes see delays in language development. They can also suffer from sleeping problems, eating difficulties, excessive crying, and attention deficit hyperactivity disorders. You should seek professional help when symptoms persist beyond 2 weeks. You can't function normally or cope with everyday situations. You have thoughts of harming yourself or your baby, and you feel extremely anxious, scared, and panicked most of the day, every day. For immediate help, or if you have thoughts of hurting yourself or someone else, call 911. Alternatively, you can call the Suicide and Crisis Lifeline at 988 or use their chat feature online. They can also provide free and confidential emotional support. Okay, let's shift a little and talk about postpartum anxiety. I came home on day 3 or 4, and the moment I walked into the house, I burst into tears. The feeling I wasn't going to be able to cope with this. Does that sound familiar? This is one of those that most of us feel like we've experienced at some point or another. 1 in 5 women has experienced postpartum anxiety. Postpartum anxiety comes with both physical and mental symptoms. Once again, we've got a long list of symptoms on this slide. Take your time looking through these. Some signs that you may have postpartum anxiety include very rigid about the feeding schedule and sleeping routine, constantly feeling like you can't cope, feeling like everything needs to be done, quote, right, having trouble sleeping, a constant feeling of worry, scared, intrusive thoughts, preoccupied and over-researching, uncharacteristic rage, tension in the chest, shoulders, and jaw, pounding heart, shortness of breath, butterflies in your stomach, feeling like the walls are closing in. These symptoms may be frightening to a new mother, especially when these thoughts involve harming yourself or the baby. Fortunately, when obsessions are due to an anxiety disorder, mothers are extremely unlikely to harm themselves or their child. The good news is that postpartum depression and anxiety can be treated. If you have a mild case of either of these, often things like engaging in exercise and in some cases using antidepressant or anti-anxiety medications can work. For cases that are more moderate or serious, we do know that therapies such as cognitive behavioral therapy or CBT are excellent treatments for anxiety disorders, including obsessive compulsive disorder. For some women, medications can be helpful and are more effective when combined with these therapies. You may be thinking, I can't take a medication for depression or anxiety. I'm breastfeeding or pumping. Well, don't assume that you can't take medicines for these things while breastfeeding. If you're breastfeeding or pumping, talk to your healthcare provider about the risks and benefits of taking an antidepressant or anti-anxiety medication. Medications can transfer to your baby through your breast milk. However, the transfer level is generally low, and many antidepressant medications are considered safe. Your provider can help you decide what medicine is right for you based on your symptoms and if you're nursing or pumping. When antidepressant treatment is indicated or prescribed in women with postpartum depression, they should not be advised to discontinue breastfeeding. Some considerations that you might take when deciding to use prescription medications include how big is the need for the mother? How important is it that you take one of these medications? Does the drug affect milk production? What is known about how much of the drug is actually transferred into the milk? What is the extent of oral absorption by that breastfeeding infant? What are the potential negative effects on the infant? How old is the baby? What proportion of feedings still include breast milk? You'll see on the bottom right of the slide a resource called LactMed, which is a database containing information on drugs and other chemicals to which breastfeeding mothers may be exposed. Check it out or tell your physician about it in order to determine whether one of these medications would be appropriate while breastfeeding. Over the next couple of slides, we're going to discuss some non-medication strategies that you could try to help cope with postpartum depression and anxiety. In addition to the known benefits of breastfeeding in a baby, breastfeeding also provides benefits for the mother. It releases prolactin and oxytocin, the love and cuddle hormones, which help a mother bond with her baby and provide a sense of relaxation. Cuddle your baby a lot. This releases oxytocin, as I just said, which can help lower anxiety levels. If possible, try to maximize sleep. Although the baby may wake you every few hours for a feed, you want to aim for at least one uninterrupted 4-hour stretch throughout the night. You should be mindful about your caffeine intake throughout the day so that this does not become a barrier for sleep at night. One strategy you may try is to take shifts with your partner for caring for the baby throughout the night, which may allow you to have that 1 4-hour stretch of sleep. Increase your physical activity. Despite the physical toll of pregnancy, delivery, and milk production, physical activity is one of the most powerful anti-anxiety strategies. Specifically, activities that incorporate breathing exercises, such as yoga, may be particularly helpful. Wean gradually. If you are breastfeeding or pumping and make the decision to stop, try to do this gently to help minimize sudden hormonal changes. Ask for help. Caring for a baby often does require a village. For example, if you're feeding the baby, maybe ask someone else to help with household chores. Give yourself a break. You just had a baby. Postpartum anxiety and baby blues are common. In many cases, it will pass with time. It's okay to feel overwhelmed. Parenting is full of ups and downs, and having a baby is not easy. If you have depression, you do not have to suffer alone. Your healthcare provider can help with a treatment that works for you. A few more non-medicinal ways that you can cope with postpartum depression or anxiety include finding someone to talk to, whether that's a therapist, friend, family member, or someone who will listen to you and help you. Maybe joining a support group for new parents. Prioritize rest for yourself. Go out with friends or talk with them on the phone. Find time for self-care and doing things that you enjoy. For instance, reading a book or other hobbies. Get help with household chores or errands like we talked about. Okay, we're now going to shift to talk about post-traumatic stress disorder. About 1 or 2 in every 100 women have post-traumatic stress disorder after giving birth. Post-traumatic stress disorder, also known as PTSD, is an anxiety disorder caused by very stressful, scary, or distressing events. PTSD can develop immediately following an event, weeks later, or even years later, often triggered by something. Some women can experience PTSD after pregnancy and delivery. This often stems from things like bad or traumatic birth processes, pregnancy loss, or many other things. This could lead to a fear of future pregnancies and childbirth. Once again, I'm showing you a long list of potential symptoms, these of PTSD. Take a moment to look through these. Do any of them resonate with you? PTSD often comes with things like flashbacks, nightmares, emotional numbing or trying not to feel anything, anxiety and irritability, and struggles trying to bond with your baby. It can be very challenging to come to terms with trauma, but the good news is that trauma or PTSD can be treated. If you think you could be experiencing PTSD, tell your doctor. You may want to write down how you are feeling. Maybe when you have some particular symptoms, you could write them down and discuss or write down, take note of how you're feeling, maybe what triggered those symptoms, so that you can be prepared when meeting with your healthcare provider. It is never too late to get help. In fact, PTSD can be treated many years after the triggering event. The most common treatments for post-traumatic stress disorder include therapy and medication. Therapy can assist with determining ways to cope with feelings of fear and other symptoms you may have, and potentially getting to a point that you could think about alternative options for birth down the road. If you have moderate to severe PTSD, your physician will likely refer you for psychological therapy. Some of the most common psychological techniques used to treat PTSD include EMDR, which is eye movement desensitization reprocessing. This involves moving your eyes in a specific way while you process traumatic memories. Another is CBT, or cognitive behavioral therapy. This is a short-term form of psychotherapy that focuses on the here and now, on the problems that come up in day-to-day life, helping you to identify and challenge unhelpful thoughts and to learn practical self-help strategies. And finally, peer support groups. What are some ways that you might be able to help yourself if you are experiencing PTSD? Talk to your partner, family, or a friend about what happened and how you're feeling about it. Try not to feel guilty and ashamed about it. These thoughts and feelings are not your fault. Look after yourself. Maybe practice relaxation exercises. Eat well and exercise often. Do not use alcohol or smoking to try to cope with your feelings. Accept that it takes time to recover. Don't be hard on yourself. And finally, accept the help that is offered to you. Okay, so I'd like to take a minute to circle back to my very first slide of the day. If anything we talked about throughout this presentation resonated with you, please consider reaching out to one or all of the following resources. And finally, the thought I'd like to leave you with today is that postpartum depression, postpartum anxiety, and post-traumatic stress disorder are not character flaws or weaknesses. You do not have to deal with these things alone.